Ectropion. This is me, Dr. Hatem Khattab, a consultant ophthalmologist, Zagazig University, Egypt. Bismillah ar-Rahman ar-Rahim. This diagram illustrates the forces acting on the lower eyelid to maintain normal position. The definition of ectropion is rolling out of the lid margin. Concerning the linguistic origin, this is the linguistic origin of the term ectropion. Concerning the degree of ectropion, it may be classified into mild, which is a version of the lower punctum, moderate, which is a version of the palpebral conjunctiva, and severe, which is a version of the lower fornix. An example of mild lower lid ectropion. Another example of mild lower lid ectropion. Bilateral severe lower lid ectropion complicated with eczema. A severe lower lid ectropion. As regards the etiology, may be senile, spastic, cicatricial, paralytic, mechanical, or of combined mechanisms. As concerns the senile ectropion, it affects the lower eyelid. It occurs due to senile laxity of lid skin and ligaments. An example of senile lower lid ectropion, senile left lower eyelid ectropion, senile lower eyelid ectropion. An example of severe senile ectropion with lag of thalamus. Other examples of severe senile or lid ectropion also with lag of thalamus. Other examples of the same condition. As concerns the spastic variety, occur due to spasm of the muscle of rhyolan, for example, in conjunctivitis and keratitis, plus over support of the eyelids by the glue, as in proptosis, staphylomata, and in children. The cicatricial variety is related to the formation of a cicatrix or a scar. When we go back to basics, the eyelid is functionally or clinically divided into anterior and posterior lamellae. The anterior lamella is composed of skin and connective tissue plus orbicularis oculi muscle. The posterior lamella is composed of tarsus and palpebral conjunctiva. This is an illustration of the anterior and posterior lamellae of the eyelids. Another representation of the anterior and posterior lamellae of the eyelids A third and last representation of the anterior and posterior lamellae of the eyelids. The golden rule: any disease causing anterior lamellar shortening produces ectropion. Cicatricial lower eyelid ectropion, lower lid cicatricial ectropion with lagophthalmos, lower eyelid cicatricial ectropion with lagophthalmos, lower eyelid cicatricial ectropion. A comparison between the preoperative and the postoperative appearance of the same patient. A cicatricial lower eyelid ectropion, a cicatricial upper eyelid ectropion, both upper and lower eyelid cicatricial ectropion with lagophthalmos. Postoperative appearance after skin grafting. A lower eyelid cicatricial ectropion due to a sclerosing lid tumor. Bilateral lower lid cicatricial ectropion due to ichthyosis. Right for eyelid cicatricial ectropion caused by severe scarring after herpes zoster ophthalmicus. As concerns the paralytic variety, it affects the lower eyelid only due to paralysis of the orbicularis oculi muscle as in facial nerve palsy. Paralytic ectropion with lagophthalmos. Paralytic left lower eyelid ectropion with lagophthalmos. Paralytic lower eyelid ectropion with lagophthalmos. Paralytic lower eyelid ectropion. Other examples of paralytic lower eyelid ectropion with lagophthalmos. Paralytic lower eyelid ectropion with lagophthalmos. Paralytic lower eyelid ectropion with lagophthalmos. Paralytic lower eyelid ectropion complicated with lagophthalmos and exposure keratopathy. Regarding the mechanical variety, it affects the lower eyelids only. It is due to increased lid weight, as in tumors or multiple chalasia. Mechanical lower eyelid ectropion due to eyelid mass. Mechanical lower eyelid ectropion due to eyelid mass. Mechanical lower eyelid ectropion due to eyelid tumor. Combined mechanisms may produce ectropion. As an example of combined mechanical and cicatricial ectropion due to a skin cancer. Combined paralytic cicatricial involutional ectropion pre and post operatively. The complaint in such cases is epiphora. Also, the complaint may be eczema, especially in severe cases. Ectropion produces epiphora. Epiphora leads to eczema. Eczema aggravates ectropion, and so on. Patient enters into a vicious circle. If you please concentrate on this complication. This is an example of lack of thalamus. Sometimes it comes with exposure keratopathy. An example of exposure keratopathy due to lack of thalamus mainly affects the lower one-third of the cornea. Another example of exposure keratopathy. What to do in such cases? في قاعدة شرعية عندنا اسمها درء المفاسد مقدم على جلب المنافع. First of all is corneal protection by artificial tears and antibiotic ointments. Plus or minus lateral cartography. The definitive management depends upon the etiology, the severity, presence or absence of complication, plus the surgical choice or the preference of the surgeon. In the senile variety, surgical correction is done. In the spastic variety, the treatment is treatment of the cause. In the cicatricial variety, we excise the cicatrizing tissue with skin grafting. An example of cicatricial ectropion treated with skin grafts. A cicatricial lower eyelid ectropion with lack of thalamus. This is the post-operative appearance after skin grafting. Regarding the paralytic variety, lateral tersophy is done in most cases. Mechanical ectropion. The treatment is treatment of the cause. For communication, this is my WhatsApp number. This is my email. This is my Telegram channel. Don't forget to like this video, subscribe, enable notifications, share, and comment. Thank you and have a great day.